Bowel clinic doesn't means that only when the patient is having a symptoms you need to come and meet me. No, because as the patient's age advances, like more anybody who is after 50 years, the chance of malignancy will rise. Because if I do a colonoscopy, anybody after 50 years, if I am doing 100 colonoscopy, I might be getting a polyps around 10 to 20%, which are pre-malignant conditions, and these things can be easily cured and removed from the endoscopy only, so we can prevent the occurrence of the new colonic malignancies. And also it will help you to screen your colonic malignancy, because somebody in your family would have been having a colonic cancer or gastric cancer or any cancers are there at any point of time. You are at high risk. So if you are having a family history of cancer, or if your age is more than 50 and you are having a risk factors like a smoking, those things will add into your risk category. So anybody who is after 50 years, please come and get your colonoscopy done, so that you will be free from the tension of the future colonic malignancies.
At Cytecare hospitals, from the Institute of Gastroenterology and Hepatobiliary Sciences, we run a bowel and stoma care clinic. In bowel care, I think bowel diseases are increasing in number with the present lifestyle and dietary habits. Bowel diseases not only include benign diseases but also bowel cancers, the colon cancers and rectal cancers. So we provide a comprehensive approach to all your bowel problems, including cancer of the bowel. Plus, we also run a stoma care clinic for people with stoma. It may be either a temporary stoma or a permanent stoma. We provide a stoma care nurse and a comprehensive approach with psychologists to educate and deal with the psychological aspects of stoma care. Plus, we also run a stoma care clinic for people with stoma. It may be either a temporary stoma or a permanent stoma. We provide a stoma care nurse and a comprehensive approach with psychologists to educate and deal with the psychological aspects of stoma care. We also provide surgeons help in reversing certain stomas.
Everybody knows about their pancreas, so they know that it is one of the important organ of their body. So everybody gets scared whenever they say they have a pancreatitis, and they tend to move on to one place to another place, pancreatitis, because the role of the doctor doesn't end by diagnosing the pancreatitis but the management. That's why, keeping this in mind, we opened a pancreatic clinic to address the acute pancreatitis, where a patient is having severe abdominal pain, associated vomiting, intolerable, and the pain is radiating to back, and we'll be diagnosing them with a blood test or an imaging. But that doesn't end there. The next is the thing, patient can go for an exocrine insufficiency after a post-pancreatitis. So we need to monitor their nutrition. So the clinic help you to assess your nutrition status, supplement what it is required. Suppose if you go to the chronic pancreatitis, because if the patient has got recurrent attacks of the pancreatitis, so this pancreas already damaged, so there is a need of a assessment of its exocrine function as well as an endocrine, like your sugar levels, that is a function of your endocrine, whereas your digestion is a part of your exocrine function. So patient might be having, many of the times they will have an undiagnosed exocrine insufficiency, they will be having weight loss, they will be undergoing lot of abdominal symptoms like bowel bubbling, like lot of loud sounds, and fatty stools means lot of bulky stools, they will be foul smelling stools, but they will not be aware about their symptoms. So this clinic helps you to act as a single point of care, where you can diagnose your pancreas associated illness and also the nutritional assessment and further care. Everybody has heard about the gastritis, so everybody will keep talking about gastritis, gas. Ultimately, we'll always end up with taking some of the tablets from the medical shop, and we'll keep postponing, like, okay, I have gastritis, I'll take tablet and I'll just leave it. But that's not the end of the story, because many of the time gastritis doesn't mean that what you burp or what is the burning sensation. It can be beyond also. We always say gastritis means excess of acid. That doesn't mean that only acid is a cause. There might be many other causes, like you are swallowing your own air, or there might be ulcers, there might be cancers, or as simple as an infection which can predispose this excess of acid production. So be aware, be cautious, but it doesn't need to be frightened, but always visiting a doctor, getting investigated and find out what is your reason instead of just taking a tablets will make a sense, and it will going to help you for your better recovery.
As a result of present dietary habits and alcohol consumption, liver diseases are increasing in number. Hence, at Cytecare hospitals, we are having a comprehensive liver care clinic to diagnose and treat all the diseases of liver. Here we treat people with jaundice, we treat people with alcoholic liver diseases, we treat people with fatty liver, people with liver cancers.
At our Obesity and Weight Management Clinic, we have a comprehensive approach towards weight management. As we all know, obesity is on the rise due to unhealthy eating habits, stress, and reduced physical activity. Please come and consult our experts to know what is causing your obesity and if there is a requirement for a medical or surgical treatment. We also have in-house expert dietitians who will guide you through your weight loss journey.